Hi, I'm Chuck Vega, and I'm a clinical professor of family medicine here at the University of California Irvine, where I also serve as assistant dean for culture and community education. But first and foremost, I'm a family physician. I just took a call last night, and we had three calls from folks with COVID. So we are seeing this Omicron BA.5 surge is definitely taking hold, and it's quite real. And I feel like we've entered sort of the DIY part of this pandemic, where you can isolate for 5 days, but if you're really sick, maybe isolate for 10 days. And what do you do about that fourth dose of an mRNA vaccine? And then testing. Testing has really changed. We are using more at home antigen based testing, which is great for a lot of reasons. It's so efficient, it's great for infection control. And I think these tests are very valuable. But one of the main questions that a lot of us as healthcare professionals have regarding these tests is, how accurate are they? And I think the good news is that generally, when you accept that they have some limitations in terms of sensitivity, at home antigen tests are generally pretty accurate, even during the Omicron phase of this pandemic. So I will reference a study that took a look at folks getting COVID tested in San Francisco. And this is a preprint study, but I still think it has a good methodology. So I think it's worth sharing and thinking about. So they received a antigen test at the same time, and at the same time they received a PCR test. And so the study was really looking at the accuracy of the antigen test based on those PCR results. And they had very high rates. 40% of folks actually had a positive test who were tested. And there was quite a variability of the sensitivity of that antigen test based on the viral load and how much virus each person was carrying. So those at the higher levels of viral loads, the single antigen test had a sensitivity of 95%, so really good. But that dropped down to 65% among individuals when there was no threshold for the viral load. So they were tested as positive for a PCR. So it makes sense that as the amount of virus you're holding in your nasopharynx goes down, the sensitivity for testing decreases. And that was also backed up in a study that looked at children. This is actually a meta-analysis. And so one of the other questions I get from patients and their families is, I'm testing my children. Is this test still good enough? I've tested my children a number of times using home antigen tests. Luckily, they have not had COVID-19 yet, but we've had a number of colds and feels like near misses. And again, the sensitivity is about 71% in a pooled analysis of children. But it should also be noted that the specificity of these tests is very good. So when we're thinking about using home antigen tests and we get a positive result, we can be pretty sure that it's a true positive. So if you have a symptomatic patient, be it an adult or a child, and they have a positive test, you can feel pretty good that that is a true positive. In one study, the false positive rate was, I believe, 0.15%. So a very low rate overall in terms of having a false positive. False negative is more of a problem, and that's why it's really good to think about serial testing when I think about these home antigen tests. One antigen test, particularly if it's the day you become symptomatic or you're pre-symptomatic, may not be positive. So test again in a couple days. And if you get two negative tests coming back as home antigen tests that are negative, you can feel good that you probably don't have COVID-19. If you continue to be sick, then you can either use a third test a day or two later after the second, or it's time to go to a PCR test, which will have some improvement in terms of its sensitivity overall for detection of SARS-CoV-2. But what about PCR? It also can be associated with false negative studies. Or false negative results. So I found a meta-analysis of 32 studies, over 18,000 patients infected with SARS-CoV-2, and the false negative rate was about 12%. Remember that there are errors associated with the use of these tests if there's not an adequate sample that's being done. And we do know that Omicron is associated with a higher rate of false negative tests than previous variants. So there is the potential for user error always, even in tests that are performed by us as healthcare professionals. So we really want to be diligent about the way we're performing these tests and getting them processed as well. But I think that again, the home antigen test really makes a lot of sense. I still think they need to be more available. I know there's we're back to having shortages now during the Omicron surge, and that's a shame because unfortunately that means less people getting tested and more people potentially infecting others. But with this testing and good instruction and guidance from us as healthcare professionals, so we can have our patients make it successfully through the DIY pandemic, I think that we can hope that we better control COVID-19 overall. I hope that you found this helpful. Thank you very much for joining me today.